We all have this natural thin layer of bacteria that's on our teeth, and if it's not removed daily, it gets hard and it sticks to our teeth. At this point, then only a dentist or hygienist can remove it. This bacteria will then attack the bone, the gums, and the connective tissue that supports your teeth, causing it to become loose and maybe even losing your tooth. And then periodontal disease not only dampers your smile, but it's also been linked to a lot of systemic diseases, some of them cardiovascular diseases, diabetes, osteoporosis. So when we ask you to fill out your medical history, please do it honestly and accurately so that we as a team can provide you with the best possible result to retain your teeth for as long as possible. Well, when you sit in the chair, the hygienist will say, and you've heard them say, we're going to measure your pockets. We actually have this instrument that has a little ruler on the end, and it fits between your gum and your tooth. Normal pockets are 1 to 3 millimeters. Anything above 3 millimeters, we want to look at it more closely. We will then look at x-rays also to see if we can find any visible signs of bone loss. We will also clinically look for swollen and red gums or gums that even bleed on probing. There's a lot of factors that put us at risk for periodontal disease, but the number one is poor oral hygiene. Then we can go on to tobacco and alcohol use. The more you smoke and drink, the higher your risk of periodontal disease. Certain systemic diseases like diabetes, osteoporosis, cancer, thyroid issues, they will help contribute to your periodontal disease. And then, of course, the medications that the doctors give you to treat these systemic diseases will also influence the periodontal disease. The ones that we take for our blood pressure, for reflux, for our thyroid, antidepressants, all those medications affect your periodontal disease. And then we got good old genetics. Research shows that about 3% of us are predispositioned to some sort of periodontal disease. And then anatomy. If we have crooked teeth or bridge work, those things make it much more difficult for us to floss or use interdental devices to help keep things clean. Well, gum disease is actually a very silent disease, and it can sneak up on you if you don't know what to look for. I'll ask my patients, when you wash your hands and if they start bleeding, don't you get concerned? So why wouldn't you be concerned when you brush your teeth and they start bleeding? We will also look for red and swollen gums, gums that are receding. Us old people have heard the term long in the tooth. That's when you lose your bone and your gum at the same time and your tooth gets longer and longer. If you notice loose or teeth that are shifting position, you need to be concerned. And then, of course, we've got the obvious bad taste or bad breath that just won't go away. Periodontal disease can be treated by a periodontist, a dentist, or a hygienist, depending on the severity. And there are two paths. We have a non-surgical path and a surgical path. The non-surgical path is what you have heard the dentist or hygienist refer to as scaling and root planing. This is a very deep cleaning of the pockets to remove the bacteria that's causing the damage around the support of the tooth. In more advanced cases, sometimes surgery is needed. The most common surgery I do is called flap or osseous surgery, and that's where I will make an incision along the gum, peel the gums open, and I can actually see the teeth sitting in the jawbone, see all the calculus that's hiding in the nooks and crannies, remove that, and reshape the bone. Sometimes bone is lost in a way where I can actually add bone to the defect and regrow it. This is called a bone graft. The bone source comes from either a donor or a synthetic source. And then sometimes we may or may not use a membrane that we'll place over the defect and put the gum back over it. And this membrane inhibits the gum from regrowing and kind of repositioning itself back in there, allowing the bone to take its place and home and try to regrow. And then if you have receding gums, sometimes I can do what's called a gum graft, is where we take tissue from the roof of your mouth and we will transplant it to the area where the gum is receding. And we may be able to replace all or some of the gum. The number one thing in prevention of periodontal disease is to follow our recommendations. Remember, you do not have normal pockets. So this is going to mean that you're going to have to come in more often to get your teeth cleaned, usually on a 3 or 4 month basis. Your insurance probably won't pay for these extra cleanings, but we're not here to treat your insurance. We're here to give you the best advice possible to keep your teeth for as long as possible. So again, the number one thing is for you to be responsible for yourself and listen to our recommendations. And then the simple things you can do at home is brush your teeth for at least 2 minutes. I highly suggest an electric toothbrush. Brush and floss or use any interdental devices that we provide you with. Eat a healthy diet because keeping a healthy immune system is really important. And refrain from smoking.